Hi, my name is Elizabeth Cameron, and this presentation is for Foundations of Advanced Nursing Practice. To start, I want to tell you about a clinical experience that was very impactful to me and that I actually think about often. So while working on my current unit, which is a cardiac and stroke med-tele unit, I had a patient who was with us for, I believe it was shortness of breath. She was pleasant, but didn't seem to be very compliant with her own health care needs at home. This patient was challenging because she seemed to have a different complaint every time I went into her room. It became taxing to try to explain why she was experiencing these things, the things that she was experiencing, or to try to comfort or reassure her that she was okay. But each time I rounded on her, I spent time with her and listened to her and validated what she was feeling. Then later in my shift, she started telling me she felt different. She said she felt like she was underwater or in a fishbowl. This was very easy to dismiss her complaint, as she had been coming up with new symptoms all day long. But I didn't. I asked her to explain what she meant and when it started. And I couldn't put my finger on it, but something seemed different about this complaint. When she spoke, her speech was just ever so slurred. It was different enough for me to be concerned, but at the time I wasn't quite sure what to do with it. So I notified my charge nurse so I could have a second set of eyes assess the patient. She also wasn't quite sure how to interpret what the patient was experiencing, but together we decided to call a stroke alert. So in my hospital, there is a SWAT nurse that's available to respond to codes, rapid responses, and stroke alerts. So he arrived and assisted with getting a teleneurologist and a head CT ordered. The CT revealed that there was no hemorrhagic stroke, but also did not show any ischemia. But shortly after that, she received an MRI of the head. The SWAT nurse and I were then notified that there was a new area of ischemia that had been seen on the MRI. Based on her imaging at the time frame of the onset of symptoms, it was determined that she was appropriate for antiplaze administration and was transferred to the ICU to receive it. So I chose to speak about this experience because I really feel that it demonstrates the use of both the art of science of nursing, or the art and the science of nursing. There's an article written by Amendaler et al. In 2021 that explains that the science of nursing is based on nursing knowledge, research, and theory, and that the art of nursing, as described in an article by Vega and Hayes in 2019, encompasses the caring behaviors we perform as nurses, the qualities of care, compassion, and communication that we should demonstrate as nurses. Actively listening to patients regarding their concerns, needs, and wants, and actually responding to them. The art of nursing was used in this scenario when I spent the time to listen to the patient. This time that I spent with her allowed me to recognize when there was a true change occurring. My knowledge of the more obscure signs of stroke and being able to identify that her speech had changed, even though it was very subtle, demonstrated my use of the science of nursing. As an MSN prepared nurse, I do believe that my clinical judgment and decision making are different from being a bachelor's educated nurse. Though my bachelor's degree was a stepping stone in this development, I feel that obtaining a master's degree has improved my clinical judgment and decision making. Being an MSN prepared nurse increased my knowledge which is explained by Kellis et al. In 2020, makes nurses better equipped to communicate and resolve problems. Going back to the scenario with my patient, I feel that if I had been an MSN prepared nurse at that time, I would have been more confident about my intuition and that something was wrong. And though the outcome for the patient was that she still was able to receive the antiplays, I would have likely acted even sooner by determining that a stroke alert be called without the second of opinion in my charge. Kellis et al. Also states that higher education levels impacts patient safety and satisfaction. In a systematic review performed by Abdul Kamar et al. In 2020, it was also determined that postgraduate nursing education improved critical thinking capabilities with improved knowledge and skills. Also, I'm confident that being an MSN prepared nurse will enable me to pursue higher level roles within the nursing field. In the article by Kellis et al., it states that the development of higher order skills can enable nurses to achieve senior positions where nurses' experiences and opinions will be taken into consideration at a policy level. According to this study and a study by Song et al. In 2015, nurses who achieve postgraduate degrees can fill a variety of healthcare roles and improve the quality of patient care. Finally, graduate level nursing has impacted my perspective for decision making. The knowledge I've gained has enhanced my perspective on patient-centered care. I've been able to use a big picture approach to my care. My approach to care has become multifaceted, where my decision making incorporates the various needs and concerns for each patient. My graduate level education has enabled me to take this approach to making decisions not only for my patients, but also to make decisions with my patients. I have been able to identify clinical issues more clearly, seek to find more information in regards to the issues, and explore solutions to improve outcomes. This idea is supported by Abdul Kamar's article, in which it states that advanced degrees in nursing could impact nurses' roles across the healthcare spectrum, from providing care at the bedside to being able to influence healthcare policy at a broader level.